Okay. Okay, welcome. I am Dr. Haley Miller. I'm a pelvic floor physical therapist, and I work with pediatrics and everyone, head to toe. My focus is on obviously pelvic health, but I work on the nervous system, the fascial system, and everything else in the body. This workshop is called the Hands-on Family Wellness. It's practical tools to support infants, kids, and adults. And it's going to go over manual therapy techniques and nutritional information to help support you and your family. Hey, this is my company, TheraPro Toolbox and Collaborative. It's meant to provide education and support for families and providers and give them easy tools and information to use in practice and at home. So I am a mom of two. I'm a pelvic floor physical therapist, and I'm very passionate about education and empowering families to support their health and their family's health. And I really like to teach people how to support their health so that they can teach their kids how to support their health and prevent dysfunction later on in life. Hey, this workshop is for anybody really, but primarily for parents and parents of multiple kids, or if they're new parents, but it also will teach other providers how to do manual therapy skills for their patients. So great for chiropractors, lactation consultants, anybody who works with families. So this information in the workshop is just meant for education. It's not medical advice or diagnosis or treatment specific to you. If you need more help and guidance on this, I offer virtual appointments and in-person appointments in Aledo, Texas. Just reach out to me on my email. Hey, so try to take aside 30 to 60 minutes today for jotting down notes. And then at the end, I'll give you a little gift that will help you continue this practice later on. Okay, you will learn what to look for as far as early signs of illness, how to support your kids' digestion and your own digestion. We'll go over immune health, lymphatic flow and function. We will go over how to relieve growing pains and other muscle and joint pain. And more importantly, how to calm the nervous system down, including your own and your child's. So I'll give you 3 principles of whole family wellness and how to translate that into practical tools that you can use. And we will go over why symptoms repeat across all ages. We'll go over the techniques together, and I'll show you and demonstrate them today. And then we'll go over how to build like a framework for your family's wellness. Okay, so the reality is a lot of people are constipated. Babies and even adults have reflux. There is a lot of pelvic pain. And this is what I see a lot of as well. A lot of people have headaches, and a lot of people struggle with sleep. And there's so much tension in our bodies. There's too much stress. We have a fast-paced environment. We're always on the go. So all of these like symptoms everyone has from infancy to adulthood. It's the same pattern. So the problem is that most families are managing these symptoms separately. So they get backed up and constipated and they just deal with that. Or they're sleeping and they just focus on taking medication or focusing on right before bed so they can sleep better. The other problem is that most providers are trained in systems separately. Like they don't know how to put it together and combine it all to help the whole person. And then the other problem is the body doesn't function separately. Again, it's all connected. It all means something, and just learning how to listen and pay attention to the body is going to be the most helpful tool that you can have. Okay, so what happens because of this? We end up in these constant cycles, and we are just giving those temporary fixes, and we get overwhelmed because it keeps coming back. And then we get taught advice or get taught things like that are only going to help us temporarily and not long term because they don't address the root cause. And again, we are given fragmented care. So again, it all kind of boils down to not treating the system as a whole. Okay, so we can shift this when we understand how our nervous system works, and how our digestive system functions. If we teach you how to focus on the lymphatic system and help with tissue mobility and tension in the body, it will affect our whole body, and it is helpful for all ages. So from infant to adulthood, we work on all of these things together that combined, it will help address the root cause generally. Okay, so these are things that I see in my patients every day. So from my babies to moms and adults, everyone comes in and we talk about poop, we talk about sleep, we talk about stress, and then the aches and pains that come and go. And more often than not, there's a pattern, and it's almost the same pattern in infants as it is in adults. So we work on tension in the hip flexors, hips and pelvis, the abdomen, but we work head to toe to address tension. We also work on digestive function, their nervous system, all of it. But it's the same pattern in the little bodies as it is in the big bodies. And so we will go over how to treat all of that. So this is where the gap in traditional care is. So they treat like just the individual organs, the pain that you report that day, and then they will treat like individual behaviors. They will miss like regulating your body and your nervous system. They often miss the lymphatic system, which plays a huge part in our immune function and like tension. And they always miss tissue mobility. If our providers were taught how to touch and assess tissue mobility, we can make huge strides in traditional healthcare. Okay, so again, parents, including myself, feel very overwhelmed because of all these things that come with these problems. So the meltdowns because their nervous system isn't regulated, or my nervous system isn't regulated. Constipation, like when our kids aren't pooping, it doesn't feel good. When we don't poop, it doesn't feel great. And then the aches and pains that we deal with, the chronic headaches, neck tension, neck pain, shoulder pain, pelvic pain, anywhere. And then the sleep issues. It adds up over time, and we become overwhelmed because the little things that we were taught aren't working well. So what we really need is something that is clear, straight to the point. It's simple. We can integrate all these systems, and we have like practical tools. I always tell my patients, like, you don't really need anything, but like practical physical tools can make it a lot easier for buy-in and also just ease on your hands and body. And I will go over a bunch of different tools today to teach you what is out there and what you can use. Okay, so here is a poll that we're going to do. Let me pull it out. Okay, so just, I don't think we're going to do this today, but the age of your child doesn't really matter. It's just a quick survey. You can send me if you need specific help on this on your children's, like if you have a specific age that you're worried about doing these techniques on, just reach out to me and I can give you some tips on how to do it. Okay, we're gonna skip that. Okay. All right, so let's go over early signs of illness. So these are things that you want to look out for, and they actually happen a lot sooner than the problem happens. So if we learn to listen to our body, we can actually address it earlier to prevent it from getting way worse. So we want to look out for fatigue, mood changes. That's when they're like really irritable or just like, I don't really lethargic, that kind of stuff. Look out for sleep disturbances, not only in your children, but yourself, because the moment your system starts to get overwhelmed with a virus or you're just overworked, you don't sleep as well. You want to look out for decreased appetite. Or increased appetite. Sometimes people will eat a lot more when they're stressed or not eat at all when their systems are over stressed. Then we were going to look out for stool changes. The poop actually tells us a lot about our health. So that's like, consistency. Is it soft? Is it formed? Is it hard, pellety? And then what color it is also really important to pay attention to. And then the size and diameter also gives us another indication of what's going on in the body. So pay attention to that. And then frequency, obviously, like we want to make sure that we're pooping every day, or if it's too much and looser, something else is going on. Other signs you want to look out for is swollen lymph nodes. So your lymph nodes are everywhere basically, but the main areas we will go over. And a lot of the times when we have like viral signs or issues in upper respiratory, we start to get swollen lymph nodes here, and you'll feel it in your throat. Or in infants, a lot of the times they have lymph nodes in the back of their head at the base of their skull, and they feel like little pebbles, almost pea size. And those are first signs of like they're getting congested, they have more drainage. And we just want to address that before it gets worse and maybe turns into an ear infection or something else. Then we're going to again look for drainage. So if you have more sniffles or even drooling in infants, like sometimes that causes a lot of upper respiratory issues. Um, and we will go over how to address that. So, understanding your anatomy is really important. You don't have to know the names of them. You can just kind of pay attention to where it is in your body and what its purpose is. So, your lymph system is basically a series of tubes that collect extra stuff, metabolic waste, and extra fluid outside of your cells, and circulates it to where it needs to be and excretes it out through urination or your bowel movements. And that is where we'll go over lymphatic massage and drainage. This picture on the right side of your screen, it has your lymph nodes here, in red. Your thymus gland is an important part of your immune function and your lymphatic system. Your liver and kidneys are also important for that. And your gut is really important for a lot of systems. So if your gut, liver, and kidneys and lymphatic system aren't working optimally, you're going to have a lot of problems. And a lot of them will show up in your skin or your poop. And then your gut, again, we talked about that. We want to make sure you're emptying completely. You poop every day. You don't strain. Your poop is normal in consistency. It's soft and formed like a banana. And then your muscles also like are affected. Your muscles and fascia, basically. So those are throughout your whole body. But if you start to have achiness, joint pain, muscle pain, that's your body's sign, like it's trying to communicate to you. So learning how to pay attention and listen to your body is going to be really helpful. And also noticing the signs in your kids, like how they're feeling. And always, you're always touching your kids, but also check in on those spots that you may that may show more signs of like illness sooner. Okay. Just jot down on a notebook or on your phone, like some of the signs that you notice in your child when they start to get sick or overworked. And also do this for yourself. Or just take a mental note of what you see in your kids. I know when my kids are starting to get sick, they get very cranky and their sleep sucks and they wake up early and they don't want to eat. And it's a lot, it's a lot harder on me because they're dysregulated, and it's definitely harder on their bodies because they don't feel great. Okay, so the first thing that we want to do is work on the nervous system. We want to help get their systems regulated and our systems regulated so that our body can heal itself and do what it needs to do to work through whatever it needs to. I go over this a lot in my other workshop, the stress reset workshop for moms, but I just want to go over it briefly. So these are signs of a dysregulated nervous system. You have your physical symptoms. That's that pain, your gut issues, poor sleep, and muscle pain and tension. A lot of the times our tension is the jaw, the shoulders, the glutes and abdomen, and the feet even. Other signs are emotional symptoms. That's that anxiety, your forgetfulness, brain fog, you're irritable, just feeling off and not yourself. Behavioral signs, these are definitely my kids, but they have, they're more restless, they're impulsive and crazy, or they procrastinate. That's me. And then there's like more withdrawal. Energy imbalances. So I definitely feel this, and my energy imbalance is the feeling wired but tired, or burnt out. And I know when I'm staying up late when I shouldn't, I need to work on my nervous system. So again, your nervous system is always communicating. Just being aware of what signs it is giving you can be really helpful so that we can get regulated. Okay, nervous system support. So these are just some like little things that we can do to help with regulation. So with your kid, you want to co-regulate, and we go over this in that other workshop, but you want to start with parent and child regulation. Ideally you want to start with regulating yourself before helping your child regulate. Otherwise, it doesn't really work. You can start off with breath syncing. So if you have a little one, just putting baby chest to chest and taking deep breaths with them, or your toddler, or just kind of if you take a deep breath, more likely the person next to you will take a deep breath. So if you have older kids, just do that regularly. They will mirror what you do. Hand holding and touch. Touch is really helpful and healing for kids. They feel safe when they feel close to you. And then some kids need distance. So sometimes they need their own space, and making sure that they know that it's okay to go to their own space can be helpful too. So creating some safe space cues like, hey, let's go to your room, or let's go to the couch and we'll hold your stuffy or put your blanket on and get you warm, or whatever it is that you or your kid needs. Then other things we can do is activate the vagus nerve. We'll go over some things for that. That's going to include breathing activities, visualization, physical activities, which we will cover in the rest of this workshop, and massage, and then laughter. These are just a few of them. So activating the vagus nerve will help with your body healing itself. It can reduce inflammation and pain. When we stimulate this vagus nerve, which helps with our parasympathetic nervous system, which is responsible for the rest and digest mode, it will help us decrease inflammation. It'll help with chronic pain, and it'll help with with anxiety and depression. Okay, these are a lot of other activities you can do to activate the vagus nerve. Breath work, which we'll go over here in a little bit, cold exposure to a certain degree, and then oral activities like humming, gargling, singing, laughing, which kids can do easily. Physical activities, which includes massage, tapping, KT tape, grounding, walking, yoga, stretching, and then other specific activities. Visualization and mindfulness. This can be done throughout your day. So we'll go over some of that here in a second. And then there's other devices out there that you can pay for and apps you can download to help guide you through some of this. Okay, breathing visualization. We're going to start with this together. So I want you can keep your eyes open if you need to for safety or just being present with your kids, but I want you to visualize energized and calming air flowing through your nose, down into your lungs, filling your entire body, and then exhaling your stress and worries away. Inhale positive affirmations or Bible verses or songs that bring you inspiration and calm, and then exhale all the bad stuff out. So doing maybe 3 to 5 breaths throughout the day, visualizing this can be helpful to calm your nervous system down. Laughter is actually really helpful if you and your kids are kind of in a tough spot and things are getting crazy or they're acting out and being mean to you. Just pretend to laugh, and usually that will get them kind of like changing changing the path down the right way, so they'll get more regulated. But laughing triggers a relaxation response. It stimulates a vagus nerve. So next time you feel stressed, try to find something funny and laugh it away. Turning on a comedy show or looking up some jokes or just literally pretending to laugh can help with that. Okay, this is really important for parents and providers, but try to be where your feet are. So no matter what you're doing, whether that's cooking,
um, driving or teaching your kids something, try to just be present. So pay attention to your surroundings. You can focus on what your feet feel like on the ground that you're at. Take calming breaths as you're speaking or listening to the people around you. And then we want to unclench the jaw, the shoulders, the belly booty, unlock your knees, and then wiggle your toes. And then focus on the senses around you. So what you feel, the temperature, what you can touch, what you hear, what you see, and then just being like present in what you're doing. Okay, these are areas that we want to massage and stretch to stimulate the vagus nerve. So one of them is the neck or the back of the ear, the abdomen, and the sacrum. And we'll go over activities for this here in a minute. Okay, the best part about stimulating the vagus nerve is it'll help you poop better, which we all love. The vagus nerve controls digestion. Again, it helps with rest and digest. And when it's functioning well, it'll help regulate bowel movement. So if you are struggling yourself or your kids are struggling with bowel movements, it is so helpful to get them regulated, like nervous system regulated, before you do anything else. Okay, I won't go over this in detail, but this is a great slide to kind of give you some tools to help with nervous system regulating based on what you feel. So if you feel like you have to fight or you want to run away, I give you some ideas on what to do. And then if you feel like you're frozen or withdrawn, we want to move, shake, that kind of stuff. So just check out that free workshop for you. It's on my website. And then let's go over digestive support. So a lot of people struggle with constipation. So some of the things we can do to help with it is stretching, movement, tummy massage. Everybody should be doing this throughout their whole life just to help with digestion and tension in our bodies. Hydration is so important. Most people are dehydrated. And then nutrition and supplementation if needed. We'll go over a few recommendations here. Okay, hydration. I think my kids are they push water now on me and they say you don't want to get dehydrated, and that's their like motivation to drink water and push water on mom. So daily water is really helpful. Small sips and not chugging it so we don't get bloated. We want to do this between meals and not during our meals so that we don't interfere with digestion. Babies 6 months on, you can offer a few teaspoons of water daily if they're not nursing exclusively or bottle feeding, but it's not necessary, especially if they're getting enough milk throughout the day. Encourage water before juice or milk if you can. And then another way of offering more hydration is like homemade popsicles. And then juice in moderation. I usually dilute juice if they are really not feeling great, but we need to get fluids in. Prune juice or prune purees can also help soften stools. Pear and apple juice are great. I like to incorporate a green juice that has like kiwi and celery. They have great enzymes to support digestion and great fiber. Toddlers, you can offer just a few ounces daily if needed and really dilute it so they don't get a huge blood sugar rush. And then electrolytes can be really helpful, especially in the summer months. So if your kids are outside running a lot or you are offering some electrolyte support can be helpful. This isn't my favorite because I don't really like Pedialyte, but you can offer Pedialyte and you can dilute it quite a bit as well. Or you can make your own. It's really easy to make your own electrolytes. You just mix water, some honey, juice if you wanted to, and then a pinch of salt, sea salt, or a better salt, not table salt, and then a pinch of cream of tartar, which it sounds bad, like weird, but you don't taste it. And then you can add in coconut water or other juice for flavor. Helping with constipation, you want to you want to add more fiber into your diets as well. So you want to have more fruits and veggies, grains, seeds, flaxseed, and then also some fat. Sometimes people are deficient in like fats in their diet, so the healthy fats, so avocado, coconut oil, flaxseed oil, just incorporating that throughout the day can be helpful. Okay, so here's our first manual therapy technique. We're going to do belly circles and massage. So in infants, you can do the same pattern basically. And really, there's no wrong way to do it unless you're doing it too hard. So we will do this. You can do it over your clothes. Let me just adjust this. But you want to start, so you can start on your right hip, and then it's not going to show. Okay, right hip, and then come up to the rib cage, over to the left, and then down the side to your pubic bone. And so you can do circles like this, or you can kind of do the I love you technique where you go up to the ribs in an I shape and then up and over to the left in the L shape, and then up right side across and down the left in a upside down U shape. The other thing is I like doing half moon circles throughout my whole abdomen. And so I'll just kind of do half moon circles and I'll go across in all directions. I'll go up and over. And you can do the same pattern on infants and anybody of all ages. Another great tool is using castor oil or magnesium lotion. So just simple castor oil. And then one of my favorite magnesium lotions that's great for muscle aches too, and also has magnesium and arnica in it. It's by Earthly, and in my manual you'll have links to that as well. So adding that in for your abdominal massage can be helpful. If your kids or yourself are way backed up, doing a warm bath before or after this, or doing a massage in the bath can help even more. Hip mobility is also really important. Sometimes our pelvic floor muscles are so tight that stool can't even get out well. So we're not fully emptying and it just is backing up more and more. So doing some hip stretches in all directions can be helpful. Okay, and this is an example of a belly massage. You want to do it slow and steady. You don't want to press too hard and you want it to be comfortable on them. If they like after the bath, that's when I usually will get my magnesium lotion out and rub it all over the belly and then also do hip mobility. I forgot my baby. I should have brought that in the show. But you just want to take their lower legs and their knees, bring them up to their chest, and then turn their knees in together so their feet are out and their knees are together, and then kind of alt rock between those two positions. Okay. One thing that happens is when a kid gets backed up, they usually start to refuse to go poop. And it's perfect timing because my toddler is doing just this. But the first thing you want to do is regulate and connect with them first because they are not going to, you cannot push them to poop. You literally cannot force them to do it. I don't know how that would be possible even. They're stubborn, but the first thing you want to do is try to get them calm, get down on their level and say, "Hey, like what can we do? Do you want to take in a toy or we can read a book?" We sometimes will get away from the bathroom altogether and maybe just use their diaper just in the moment, like to deal with the constipation, and then we'll get closer and closer to the bathroom so they're not anxious about like sitting on the toilet and like dealing with the pain with pooping. So focus on connection. Then we want to make sure they're hydrated. So we want to increase the water intake and electrolytes and fiber. I'm a big fan of like watermelon and kiwis to help with that. We want to step up the belly massage. So we want to do that regularly, even after meals, after they eat, we want to rub on their bellies. And then Epsom salt bath or magnesium flake bath can be really helpful to kind of like decrease the muscle tension throughout their whole little bodies. Or the magnesium lotion. And then we want to do stretching and mobility. Yoga is a really good activity for constipation for all ages. And there's great YouTube videos out there that show you how to do yoga with kids. They're more like animal positions, like bear crawling and snake and whatever else. But another thing that I want to mention is that pediatric pelvic floor therapy can be really helpful. Sometimes there's more going on than we as parents see, and getting a full assessment can be really helpful. There's a lot more to constipation and like the connection to your bowel and bladder than we know. And having somebody else's hands and eyes on that can be really helpful. Okay, the next system we want to work on is the immune and lymphatic system. So signs of a lymphatic system that isn't working are drainage, congestion, the swollen lymph nodes, if we're dealing with allergies, and the other signs of illness. And what we want to do to help it is do lymphatic massage. We want to do some warm baths, bouncing, movement, and stretching, hydration again. And then if we are seeing upper respiratory symptoms, we want to do nasal rinses and sprays to rinse out all the crap that's causing inflammation. Histamine support. So this is where we want again to support by decreasing the inflammatory things that are causing this, like allergies, environmental, milk products, dairy products can cause more inflammation and histamine response. Sugar, decreasing sugar can be really helpful, especially in kids and adults. Okay, so if you have noticed frequent colds or congestion, or you're dealing with lots of ear infections, we want to support this system. So those are your signs like, oh, we really need more help here. And this is where we're going to take our tools and go to town with this. And we're going to do lymphatic massage. So I'm going to show you a few different tools here in a second, and we'll do this together. But lymphatic massage, like, it's really important to use light pressure. The more pressure you use, it's actually more harmful on this system. It requires like really light pressure. It's annoyingly light. And I would say it's like pressing on a ripe tomato, but almost lighter than that. We want to start closest to the heart, and then stroke towards the heart and working towards the lymph nodes like throughout the whole body. And we'll go over that for the head and neck. For infants and little ones, using a really soft touch, single finger, just kind of like stroking, being really light, or a makeup brush can make it really, really easy. And then incorporating gentle stretching and mobility and movement afterward. And then castor oil can be really helpful for those like really um, congested spots, like the lymph nodes back here or in our pelvis, armpits, that kind of stuff, or our belly. It can help kind of with the function of the lymphatic system and like eliminating the metabolic waste in that area. Okay, I'm going to show you some tools. So let's go here first, and then we'll go back. This is a a rake, like a it's a lymphatic device or tool. Like you can use your fingers, but there are tools that make it a lot easier for you to use less pressure. This is also a tool. This is an acrylic tool. It's a scalp massager advertised on Amazon, and they're really cheap and really affordable. Sorry. And then I'll show you. These are my favorite. They were advertised as like self-tanning makeup brushes, but then they started to get more into lymphatic stuff, and they created this design where there's more bumps and grooves in it. And this is my favorite for lymphatic massage on the head and neck. And then I've got my handy dandy makeup brush. This is one that was like, I don't know, gifted in some kind of promo, but my kids love this and they destroyed the cap to it. But any makeup brush would do. This is great for infants to get in those little neck crevices that you can't really reach with your fingers without like forcing it in there. The makeup brush gives, and so there's less pressure put on the skin than your finger would for those little ones. But this, if you tend to go harder, you want to like use tools so you don't like mash on those areas that we're trying to support. There is this little brush. Infants, like I guess I was gifted a goat hair brush, and that one's soft enough that you can use on yourself and your baby. And then let's see. And then there's the jade gua sha tool. Let's see, I have a green one, and there's different shapes and sizes. This one has like a grooved edge, which is great for lymphatic flow, and then grooved edges for different parts of your body. There's a roller that's also great to use. You can put this in the freezer or fridge to cool. And then we've got little suction cups for the face and neck area. They come in different sizes and shapes. And then we have little cones here. So all the different tools for different reasons. Okay, we're gonna go back. So we're gonna do lymphatic massage together. We are gonna start at the collarbones always and the sternum. And you want to do like light presses or circles or taps. And you're gonna gently tap at above and below the collarbone. Or we can get our makeup brush or a brush and brush at the collarbone, tap it at the collarbone. At the same time, we're taking deep breaths. So breathing into the rib cage, expanding it out all directions like an umbrella. And then as we finish the collarbone, we want to work our way towards the ear and neck. And we're going short, like soft strokes down to the collarbone or long, soft strokes. And then we can use all sorts of different tools if we wanted to. Then from there, we're going to work our way to the jaw. And you want to take your brush or your gua sha or hand and just kind of do short strokes to the ear and work your way to the chin and then go back down to the collarbone. So we're always finishing up at the collarbone. From here, we're going to go to like the cheekbone and nose and go to the ear and down. And don't be afraid to brush the ear. The ear actually can become congested too, and it's not very fun. And then we're going to go to the nose. Actually, the upper lip and nose drains upwards towards the forehead. So we're going to kind of go upper lip, nose, forehead, and down, down to the side here. So nose, up, and down. And you can kind of work your eyelid. A lot of the times we get pressure headaches and we feel a lot of pain at this part in the eye socket. And so working lymphatically here can be really helpful to help drain that. And then you want to work on the scalp as well. If you're working on the face, always work on the scalp. So this is where like a comb or hairbrush can come in hand, or if you have this tool or the rake, it can be helpful. So we're going to go in and just kind of do scalp massage in the same direction and back of the head and go down to the collarbone. Okay. I will show you real quickly how to do it in your shower if you're washing up. You don't need any fancy tools, you just need your hands. So if you're washing your face in the shower or at the sink, you're gonna just kind of tap here before you go down and put water on, put your face wash on, and then you're gonna go to the neck, both sides, go behind the ears. I usually will do ear circles here, and then you're gonna go from chin to ear and down, cheeks, ear and down, eyes and forehead, ear and down. And then when I'm done with my face, like putting oil on, I'll go through and do scalp massage. And then at the base of the neck, kind of go down into the shoulders. I also, I have a manual on lymphatic massage and activities coming out soon. So that should be available the next few months. But try this on yourself and your kids when you start noticing allergies, like it's really bad right now. Oh, and then those are QR codes that you can scan to get the gua sha and roller. And then this is the link here to the lymphatic brush, which is the like I don't know, $8. Okay, so now we're going to talk about aches and pains. So this includes like muscle, joint, and growing pains or cramps. Common areas that we experience it are in the legs, the knees, calves, our lower back, and then obviously our jaw and neck and hips. So what we want to do is focus on hydration and electrolytes because if you are experiencing muscle pain and joint pain, it's probably because you're like overworked, your nutrition isn't great, and your hydration isn't great. So I always ask if my patients are complaining, like, have you been drinking water? Like, how much have you had to eat today? And then working on massaging them and movement. So stretching, mobility, yoga, that kind of stuff can be helpful. And then heat is actually really helpful for growing pains and these aches. Epsom salt baths and then magnesium lotion. KT tape or compression can also be helpful for the growing pains. And then going to see a PT, chiropractor, or somebody who's trained in cranial sacrofacial therapy can be really helpful, or somebody who's a massage therapist who's really good to help with this if these are really chronic issues. Okay, signs that you might see in your kids or your maybe yourself, but If your kid has tension, you're going to see funny walking or crawling. They're usually asymmetrical, or they're doing one thing on one side that their other side isn't doing, and it just looks like uncomfortable or weird. If they're walking up on their tiptoes, or you notice you're walking up more on your toes or the outsides of your feet, that's signs of muscle tension. If you have poor posture, like we do, like looking at our phones and are working at our computers, we definitely have tension in the front and the back. If you touch your kid or even your partner and they withdraw from touch to that area, it's probably because there's tension there and it doesn't feel great. Nor touch, like light, comfortable touch should not feel painful and you shouldn't withdraw from it. And the other signs are if they're fussy and not sleeping, they may also be dealing with tension. Growing pains. Um, this can be common in like kids who are growing from like ages 4 to 18 years old. And the faster they grow, the harder it is on their body. So we want to support them with these techniques coming up. Okay, massage. Massage and touch again is really therapeutic. For a therapeutic touch, we want to do gentle and slow pressure. It's way more appropriate for pain. Harder pressures, like deep tissue pressures, actually increase the input to our nervous system and causes a protective response. So, for those of you who are like, they just can't get deep enough, or those like trigger points, and I always get hard, deep tissue massages, it actually can be harmful and cause more tension if you haven't addressed like your nervous system and the true cause of that tension. So deeper isn't better. And then if massage isn't helping, we need to address the lymphatic system and the nervous system first. So working on the congestion, inflammation in that area, and then regulating our nervous system will be way more helpful because then our body feels safe to relax and not guard, and our like things lymphatically, it's flowing well and nothing is getting built up in those areas. I actually had a patient today, and I get with allergy season, she was clenching her jaw and she woke up with like severe neck pain, and it was very congested today. And so we started with lymphatic massage first, and then we got into the muscles and then mobility and stretching. And we used all these things on her, and and she had more range of motion afterwards and less pain. Okay, with massage, we can also use magnesium lotion or coconut oil, and I love arnica lotion. It helps with tissue healing. This magnesium lotion has arnica and magnesium, obviously. And then we can use our hands for massage, again, soft pressure, and then suction cups, which we'll go over. So all sorts of different sizes and shapes. And I'm a fan of dynamic cupping, which we'll go over here in a second. Not static cupping where they leave bruises afterwards. And then we want to use Epsom salt baths or magnesium flakes, and we can use heat before and after if we wanted. Heat before a massage can help reduce the time that we need to massage the area, and it will soften and increase blood flow. Okay, so we will do a few things. So neck massage is great for stimulating the vagus nerve. So this is just a video on doing some gentle massage in the back here. And again, you can use circular like motions, but again, we don't want to go too hard. And we want to just introduce like movement to that tissue here, or you can use two hands and do gentle circles down the back sides or the sides of your neck. Okay, this is a video of a baby massage. And so, like, you see soft touch. She's not pushing down hard, and she's doing slow, rhythmic movements. And baby seems comfortable. The moment that you push into some tissue and you notice kind of a freeze response or a guarding, or they stop breathing, that means it's too much. So, we want to make sure that the nervous system is regulated, and we don't do that by pushing in too hard. So we want to introduce soft, light touch. Foot massage can be really helpful too for growing pains. If we just address those areas of growing pains, which more commonly are at the knee or like thighs, we're not addressing the whole picture. So a lot of the times our feet get really tight. Most people's feet are really tight or weak, and doing toe massage, foot massage can be really, really helpful. Also, really helpful for the lymphatic system. Okay, so this is the gua sha stone. This can be an acrylic tool, stone, it can be metal. And I have used like a spoon handle or a knife handle when I'm traveling if I need to address some muscle tension. This can be used at any part of the body and over clothes or on bare skin with oil. And when you do this, you want to go at an angle, and you can do short strokes, and we don't want to go too hard. So the moment you start putting too much pressure in, you'll start to feel like your muscles tense up around you. Again, deeper is not better. Um, and we can do long strokes until our tissue, like our skin gets used to it and our muscle gets used to it. We can do this over our shirt and over our pants. And then we can get different sizes. So this is one tool. It looks kind of crazy, but you can reach further with this one if you need to get your neck muscles or your back muscles. There's different things out there. Okay. And then cupping. I use this like daily. So with cupping, the top video is static cupping. And these are what leaves those bruises, those circular marks on people. I don't particularly like it because it can be more painful. But it is still therapeutic if done right. And you don't want to just go see anybody for this. And you don't like more is not better. So you don't want to keep like suctioning the skin and causing more pain because, again, we cause a protective response and our muscles tense up around it. So static cupping again is keeping the suction in one place. And then dynamic is introducing movement, whether that is the cup moving around or the body part is moving around. So we'll go over that. So if you have, usually with cupping, you need to have oil on your skin. I do this in the shower with face wash, or I'll put a thin layer of conditioner on my belly or my arm or my leg, wherever I'm targeting. So you want to put oil on the skin so it glides and it stays suctioned. And then I'm going to use a small cone-shaped suction cup here, and then squeezing it. And I'm going to release that squeeze when it's like resting on my skin. And so it's staying. Then I'm going to glide that cup, and it may lose suction as I work it because it's tight. But keep squeezing and suctioning, and start with less suction because it can be really sensitive, and work up to more suction. You want to do what's comfortable. I will say that tighter areas, it may start to bruise as you glide across it, but that's like it's probably really needed in that area. Now on kids, you don't want to go that hard. We can do cupping on children. We just want to keep it lighter because again, deeper and more is not better. Um, we have a good effect of just suctioning and releasing as well if we don't get a good glide. And we can do this on our jaw, we can do it on our neck, our bellies, literally any body part that you can get a good suction to. Um, Smaller suction cups can be helpful. This is a bulb suction cup with a glass tip. I wouldn't I don't let my kids see this because they would play with it. But this has a great suction for the face, and you can do a lot more with this one, especially in smaller areas. Okay. And then, okay, I'm going to show you the static cupping version. So if I wanted to just kind of like keep it still, I can introduce movement by like rotating or straightening my arm out. Um, and then if I wanted to cut my arm, I would just do arm raises and movements with a cup on that area. You can get creative with it. You can have two cups at once, and then you can move one around the other, or you can just kind of move move with two. Okay. Kinesiotaping is really helpful and easy to use. If you are sensitive to adhesives, I wouldn't recommend this. If your kid is way sensitive to topical products or Band-Aids even, I wouldn't do this. But for growing pains around the knee or any aches and pains, if you just have like a pinpoint pain, we can do kinesiotaping on that area and get lymphatic support and muscle support and joint support. It gives our nervous system like a hug to that area and it tells our brain like, oh, we're supported. Like I'm not going to hurt anymore. And it'll kind of like offload that tissue to allow it to calm down and then get better. So with kinesiotaping, there's like a million brands on Amazon now, or out there. It has and I don't know if this one does. It does. Okay. So it has a fingerprint technology where the adhesive is like in a wave-like pattern. I don't know if we can see that maybe there. So it has a wave-like pattern. And the in between the adhesive is where it gets a lift. And that's going to help with lymphatic flow. So if you have a spot that hurts, we can create a star um, application over that or a cross application. And when we do this, we'll cut two pieces of tape and then I usually just tear it down the middle and fold these edges over. So I have a handle here and we want to apply like 25% stretch. So here's 100, here's 50, and here's like 25%. So you can stretch it as far as you can. And then you're going to apply it to the area that hurts. And then you're going to release that, I don't know, 2-inch square at the end as its anchor and then smooth it out and smooth out the other side. And then do another piece to kind of cross over it. So I'm going to stretch it, apply, and anchor it by releasing those ends. So there's a lot of videos on YouTube. If you just kind of do a search of one, they're generally safe to use. I would say if it makes it feel worse, take it off and it's not appropriate. And then this can last 2 to 3 days. It's can even like go into water. You can shower with it. It'll start to roll up and get kind of gunky. If you have a hard time taking it off, put a layer of oil on, let it soak, take a warm bath or shower, and then pull it off gently so it doesn't hurt the skin. Okay, so we went through a lot. The main principles behind family wellness is regulation before we do any intervention and use any like tool. And then we want to focus on the lymphatic and the tension system. So that's when we can use our hands for massage, do lymphatic massage, do the brushing, the taping, the cupping, and flow and technique matter. So again, we want to start with nervous system regulation, lymphatic, and then muscle tension. And when we go in that order, we have better outcomes. And we also want to use lighter pressures, softer techniques. We don't want to go too deep and too hard, and we don't want to cause a protective or guarding response. So again, these are just simple principles. We want to start with the nervous system because then our body can heal itself and feel safe, and then focus on the other systems next. Okay, this is a quick tool recap. So we can use all of these things for different purposes. So muscle aches, joint pain, we can use magnesium lotion arnica, use our tools, suction cup, gua sha, massage. With magnesium lotion, you just put it into the affected areas, rub in nightly or daily, and then gentle suction. And you can do that every day as long as it's light or 1 to 3 times a week. We don't want to cause too much bruising, especially in kids. Everything with kids we want to do super light. With constipation, we can use a castor oil or magnesium lotion rub for the belly, do belly massage. We can do our baths and soaks. Growing pains, we have all the things. We have the Epsom salts, the magnesium, arnica lotion. I should put in there heating pads, and then warm soaks. If they struggle often more at night, like at the end of their day, or they wake up with growing pains, do a bath before bed and magnesium lotion in those areas so that they can sleep better through the night. Heating pads can also help. lymphatic flow and massage using those soft brushes or combs and gua sha. We want to do strokes towards the heart, starting nearest the heart first. I would say you can do this daily. I teach my patients to do this every time they shower and every time they rub their baby down with lotion or get their baby dressed. So I think the more often you can do lymphatic support, the better your whole body feels. Congestion, again, we're going to focus on the head and neck using gua sha, the brushes, and we want to do gentle sweeps away. Hey, right. We'll skip. If you have any questions, feel free to email me. If there's like a specific issue that you've been dealing with, just reach out and I'll offer you some suggestions. Hey, and then as a special gift, I have this guide and I will give you 50% off. It's pretty thorough and has like all this information and more on all these practical techniques to use for yourself and your family. And again, the stress reset workshop for moms is free, and this is where you learn way more like techniques for you and your family to regulate. And then there is a class coming out on the vagus nerve on like really detailed instructions and manual therapy and practices on tapping into the vagus nerve to help with that stress and overwhelm feeling. Okay, these are other guides out there. I have a written guide for the vagus nerve, and then also for infants and kids with oral tethers, I have a guide on addressing the whole body to deal with oral tethers. It's called From Tethered to Thriving. That's on Amazon or ebook on my website. And then coming soon is the full guide on lymphatic massage and support. And it goes over like all the tools and techniques with activities and stretches to help support it. So again, I hope that this has helped you. I hope that you feel more empowered to take care of yourself and your family. And my goal is to give you the tools so that your kids can take these tools and help care for themselves later on. Because if we address all these patterns earlier on, we are better off as a later on as adults. So if you know you were constipated as a kid and have always been constipated as a kid, you probably could have benefited from these tools and techniques to get you regular. So if you have any more questions or need more help, just reach out.